So last year, that was kind of the ideal scenario where I felt we were going in a great direction. We have a lot of great initiatives, good leadership, wonderful, wonderful employees. And then bam, it hit hard. We were hoping not to see the day, but I remember that Friday morning, March 6th, we already set up what we call our incident command team, and we're just meeting in the room, and all of a sudden I found out a few hours earlier we had our first positive case in the state of Indiana. And I got goosebumps, but not in a good way. And I realized this is the beginning and this is real. I realized we had to move at a pace we've never moved before. And the thing about moving at that pace is you don't know the unintended consequences from it. So during those early stages in terms of how the physicians and nurses felt, it was a whole range of emotions that you might expect. But one of the big ones is anxiety and fear, because everybody's terrified. Am I going to get it? Am I treating the next COVID patient? Am I going to get it from them? So this immense amount of trepidation, anxiety, and fear. What can I do to protect myself? Do I have the right mask on? Do I have enough gloves on? And so on. So the biggest fear is that every single nurse and physician was worried about that. And that was real because we didn't know. And we didn't know who had it or not. We didn't have enough tests. We actually didn't know in our hospitals who had coronavirus. It would literally take 4 to 7 days after you did the swab to find out. My wife, when she went in, she had the virus. And in my position is why I couldn't see her. And I remember how devastating it was for my wife. It was so bad for her that she was by herself. I actually took her out of the hospital earlier than the doctors wanted. She was on oxygen and had a bunch of other treatments, so I set up literally a mini hospital bed in my house, and I took care of her because that loneliness when you're by yourself, because even the nurses can't come in that often, but your loved ones aren't there, so that loneliness and emptiness you have is terrifying. So I actually told her, I said, it's not going to be a big deal because you're fine, you're young, you're healthy, you have no medical issues at all, so don't worry about it. So I kind of blew it off, and so I didn't think she had it. She had some body aches and so on, but didn't feel like it. But then later she started having some fevers. I thought she did have it. So then I kind of stopped my work. I was doing everything from home anyways, but I stopped working and really was taking care of her. When I was sick, I had the coronavirus myself about 2 weeks earlier, so I did have a pulse ox machine at home. So I've been checking her pulse ox. I remember vividly this Saturday morning, April 4th. Her pulse ox in the morning was 95%. Around noon, she said she feels a little nauseous. She's going to take a nap. And she woke at 4. She said, I still just feel nauseated. She's not short of breath or anything. And I listened to her lungs and things sounded fine. I checked her pulse ox, and her pulse ox at that point was 75%. It dropped from 95 to 75 in a matter of hours. I normally am very well balanced. I was scared. When I saw my wife saturated at 75%, I felt helpless. So I called the emergency room, and I was driving there, and then the saturations dropped to 68%, and I was in near tears. I was thinking I'm going to lose my wife. It was one, because I didn't think she was that sick, and I just didn't think it would happen to us. By God's grace and by the help of all the medical teams, she did come out of it, and we got her through it. I don't believe in coincidences, so I actually think it was meant to be that happened to my wife. It happened early on. It happened in the first week of April in the pandemic. The first case was March 6th. My wife got sick April 4th. That gave me a perspective I would not have had before about how lonely it is to be by yourself in a hospital room, how the doctors may or may not see you, and how that mental health affects your physical health, and then how it affects everybody around you as well, and then also on how aggressive we need to be, both in terms of medication but emotional support. So in terms of, the most exciting time of the year was in November. And I remember hearing the news about the vaccine. I remember hearing that on December 9th, the FDA is going to meet. December 10th, they're going to approve it. I'm going to have the vaccine in my hands by December 18th. I remember all those dates so clearly because that was the first unbelievable ray of hope that we had. It was just phenomenal. I think we could be proud of ourselves that we were able to believe in science. Getting a vaccine in under a year is phenomenal, and believing and trusting in each other. And so I do think I do think it shows the resiliency of the country, resilience of all Hoosiers, to really be able to get together. And so it does give me a newfound energy and hope for all of us. I think all of us in our lives, we always just want to leave the world a better place, be more impactful. And so I think every one of those people, all these are heroes. And you don't need to be, you don't need to work in a hospital. There's so many essential workers. And I think we all feel good about each other and how we could work together as a team. So in the end, while it was a miserable year and never want to live again, I think we're all stronger. And I think we realize how resilient we can be.